So you do the cosmetic dentistry in the practice.
That's correct.
So tell me, who's the typical patient for cosmetic dentistry?
The typical patient is anyone who doesn't like their smile, who wants to do something about it. They want to change the shape, they want to change the color, they want to change the angle of the teeth. And cosmetic dentistry is a way to do that. So for a patient that has a broken tooth, mostly a posterior tooth, a back tooth, it's really nice. We actually have the technology located in our office to make on-site crowns. So a patient gets a crown done in one visit. So they come in, get them nice and numb, take care of them, do what we need to do. One of the technicians comes in, uses new technology and scans the tooth. And then we send that information to a computer and we design the crown right there in-house.
Right there.
Yes. So it's pretty neat.
Now with porcelain veneers, because we're talking about cosmetic dentistry and smile makeovers, how does somebody know what their teeth are going to look like? Like, how do you show them what that end result's going to be with veneers?
It's actually a really, really cool process. So what happens, a patient comes in, we have a digital camera to take full face photos. Some are actually close up of the teeth. And what we're looking at is to see how the teeth relate to a person's face. And it shows us a lot of information that we can talk to the patient about, because more than likely they have not looked at their teeth like we're actually looking at their teeth. Yes, they see the imperfections, but they don't see the rest of the story. We're trying to look at the mouth as a whole. We're looking at the teeth in relationship to the gums as well as the face. And we sit down with them and we ask them, hey, have you ever looked at your teeth like this? Have you ever looked at the way that your gum heights aren't the same? Have you ever looked at the way this tooth is tilted? Have you ever looked at the way this tooth on this side doesn't match this tooth on this side? So we're looking at symmetry as well. So we sit down and we talk about it. Do you want to change anything about the way that those teeth look? And if so, what is it? And from there, we can look at some pictures of cases that have been done where the teeth are a certain shape. Sometimes people want a more masculine smile. Obviously, sometimes people want a more feminine smile. So there's little things that you can do as far as shape-wise goes that can portray that for the patient. And we sit down and we kind of come up with a plan together. From there, what we would do is we send that information to the lab, and the lab can come up with an actual replication of what it would look like for the patient. So then they can see visually with their eyes what it's going to look like. But we can also take it a step further and have them try in their smile.
Is that right?
And,
okay.
Yeah, and nothing's changed, nothing's permanent. It's just a trial run.
So like a temporary smile.
Yes, yes.
They look in the mirror. Do they ever say, I want these?
Yeah, and then sometimes they're like, well, I think I might want to change a little of this. And that's fine, because that's what we want them to do. We want them to be happy with that. And if there's any tweaking involved, then we can do it before we even begin the process. So they are comfortable knowing, hey, this is what I want, and this is the direction we're going to go. And they understand what I'm asking of them, because the communication is huge in that respect.
So once they get these temporary teeth, they wear them for like a week or two. The teeth are being made, the porcelains, and they come back and just get the porcelains?
Correct.
That's it? Okay, good.
Yeah.
You do a lot of this?
We do. Yeah. And some it's very small, a couple teeth, but then sometimes it's a lot of teeth. It's top and bottom. If patients have a significant problem with wear on their teeth, if they want to rebuild them, if they're losing function, they're not able to actually chew their food, then we sit down and we talk about it and we explain the reasons why it's important to be able to chew your food. What our goal is at our office is to not only protect their teeth for now, but long term. So what's going to happen when they're 60, 70, 80? Are they going to be able to chew their food effectively? Are they going to be able to keep the natural teeth that they have? Are they going to start to lose them? And if we can do anything on the front end to actually protect their teeth and keep them in their mouth, that's what we want to do. And we're able to do that. And that's what's great about my job, is that I am able to do that if that's what patients want.